Hello, good day. My name is Nicolai Charles Almazan and my partner is Maria Rufina Ali. Me, you know me as Prez. And you know me as the caregiver representative of ACTEC. And my partner is Ruth. Okay. The disease that I'm going to talk about is bradycardia. Bradycardia is when the heart does not operate as it is supposed to and develops an abnormally slow heart rate that is less than 60 beats per minute. The condition is known as bradycardia. Actually, bradycardia is the main symptoms of it is a heart rate below 60 beats per minute. It is abnormally low. Over heart rate can cause the brain and other organs to become oxygen deprived, which can lead to symptoms such as fainting, dizziness, fatigue, weakness, shortness of breath, chest pain, confusion, memory difficulties, quick tiring, and physical activities. In your cases, when bradycardia goes undiagnosed for an extended period of time, the following complications can occur: cardiac arrest, angina, high blood pressure. Well, the causes of bradycardia include injury to the heart due to heart attack, endocrine disease, or a medical procedure, inflammation of the heart muscle, low thyroid function, electrolyte imbalance in the mood, sleep apnea, congenital heart defect, valvular heart disease, Lyme disease. Okay, I'm gonna turn it over to Ruth already. Thank you.
Yes, thank you, Prez, for the wonderful introductions and giving us knowledge about bradycardia. I will now discuss what the risk factor, prevention, treatment, and home remedy for this disease. We heard it earlier from Prez Nicolai, the definition, signs and symptoms, and the causes of bradycardia that we need to know. So listen again carefully. It may help you if you or your family have this disease or you're having experiences some symptoms. So bradycardia can be life-threatening, so we need to take care of our health and heart. So here are some risk factors that could contribute to bradycardia. It's include age, congenital heart defect, electrolyte imbalance, infections of the heart, previous heart attacks, low thyroid, medications for other heart problems. So there are the risk factors. So how can we prevent the bradycardia? So while some bradycardia risk factors like age and congenital heart defects can be controlled, the most effective ways to prevent bradycardia is to reduce your risk of developing heart disease. So take this step to help prevent bradycardia. Number 1, control stress. When you are stressed and have anxiety, your blood pressure is increased. So avoid unnecessary stress and learn healthy ways to handle everyday tension. So don't smoke. We all know smoking does not do any good to our system. It destroys any part of the organ in our body. So if you already smoke and are having trouble quitting, please quit now. So don't use recreational drugs. So if you're using illegal drugs, talk to your physicians about treatment programs. So exercise and eat healthy. It's also the prevention. So two of the simplest yet most important ways to help your heart health are through diet and exercise. So eating health diet can help reduce the risk of heart disease and stroke. Exercise makes your heart stronger. This helps it pump more blood with each heartbeat. With more oxygen, your body functions more efficiently. So get regular check-up. Have regular physical check. If you experiences new or changing symptoms, see your physician. So if you drink too much, or if you drink, do so in moderation. So excessive alcohol intake can lead to high blood pressure, heart failure, or stroke. It can also directly damage heart muscle, which may weaken the heart. So ask your physicians for advice. Limit your intake if you can consume alcohol. So keep blood pressure and cholesterol under control. So make the lifestyle changes listed above and take the medications as prescribed. Also, maintain a healthy weight. So exercise and eat a healthy, balanced diet to stay in a normal range. So monitor and treat existing heart disease. Understand your treatment plan, take medication as directed, and report new or worsening symptoms immediately to your doctor. So how is it treated? So bradycardia is treated depends on what is causing it. So treatment also depends on the symptoms. If the bradycardia doesn't cause symptoms, it may not be treated. So you and your doctor can decide what treatment is right for you. So first, if damage to the heart electrical system causes your heart to beat too slowly, you will probably need to have a pacemaker. So pacemaker is an implanted device that helps correct the slow heart rate. So you will see the picture. Yeah, that's the pacemaker. So it is contain a battery and computer circuitry in a metal case to correct slow heart beating. So pacemaker continuously monitors your heart, and if it detects low rhythm problem, it sends out small undetectable electrical signal to correct it. So most people who get pacemaker lead active and normalized. So you will need to avoid things that have strong magnetic and electrical fields. This can keep your device from working right. But most electronic equipment and appliances are safe to use. So your doctor will check your pacemaker regularly. Call your doctor right away if you have symptoms that could mean your device isn't working right, such as your heartbeat is very fast or slow, skipping or fluttering. You feel dizzy, lightheaded, or like you might faint. So you have to shortness of breath that is new or getting worse. So call your doctor. So another treatment, if another medical problem such hypothyroidism or an electrolyte imbalance is causing a slow heart rate, treating the problem may cure the bradycardia. So the last is if the medicine is causing your heart to beat too slowly, your doctor may adjust the dose of prescribe a different medicine. So the goal of treatment is to raise your heart rate and relieve symptoms. For certain types of bradycardia, treatment may help prevent seriously problems. So these problems include fainting, injuries from fainting, and even death. So what can you do at home for bradycardia? So as I said a while ago, to live a healthy healthy lifestyle will usually improve your overall health. So the steps include having a healthy eating plan that includes vegetable, fruits, nuts, beans, lean meat, fish, and whole grains. So limit alcohol, sodium, and sugar. Changes to your diet can fight cardiovascular disease and improve heart function. So being active in most. So losing weight if you need to. Not smoking. So managing other health problems such as high blood pressure, high cholesterol, and diabetes. Acupuncture also may be helpful. It is also indicated for cardiovascular health. So it reduces the risk of coronary heart disease in people with fibromyalgia. So reduce stress, lessen use mobile devices every day. Stressor and health problems cause stress. So it seems that it has just become a regular part of our life. Stress is one of the most destructive emotional conditions that we can have, as it can cause chronic headache, certain disease including hypothyroidism, and it's associated with an increased risk of the heart disease. So sleep. When bradycardia symptoms are caused by sleep apnea, adjusting your bedroom temperature and humidity levels by help. It may help. So sleeping with your head elevated and using of a snore guard may also help. So 6 to 10 sessions of cognitive behavioral therapy may improve sleep quality and insomnia symptoms. So get emergency help if you're fainted, or if you have symptoms of a heart attack or have severe shortness of breath. Call your doctor right away if your heart rate is slower than usual. You feel like you might pass out or you notice great shortness of breath. So, that's the end of our reporting regarding on bradycardia. We hope you have learned something that you can use in the future. We're not hoping you have this disease, but of course it's better to know and be prepared. So thank you.